I'm Dr. John Stenberg at Zenith Chiropractic in Colorado Springs, and I wanted to address the condition called Meniere's disease with you today. It's one of the things that we've commonly seen a great deal of success with by just considering certain factors that are often overlooked in a comprehensive plan of care for folks that are suffering with Meniere's disease. So Meniere's disease is a syndrome that consists of a variety of different symptoms. Now, depending on the person's unique situation and the severity of their condition, their experience of those symptoms will be different case by case. But one of the things that is very commonly included is neck pain, headaches. We often see vertigo, which is a sensation that the world is spinning, often accompanied by nausea and vomiting, ringing and a sense of fullness in the ears, and in more advanced stages, hearing loss associated with Meniere's disease. One of the things in consulting with patients that are experiencing these types of symptoms or conditions that we find is often overlooked in their full history is an understanding of the structural trauma that they've experienced. So when I say structural trauma, we mean things like a whiplash injury, which is an acceleration-deceleration type force to the spine, where the momentum of the head and the neck moving through space is abruptly stopped or reversed. And that can create a tremendous deal of shearing forces throughout the neck. So when we experience those types of forces, we can tear and injure the soft connective tissues that hold the bones in place and provide safe and comfortable movement. When that happens, you'll usually have some irritation and some inflammation and some pain and swelling associated with that. That will gradually heal over time. What we often overlook in that healing process is a structural shift away from the center of gravity of the weight of the head. So when that weight becomes abnormally distributed over the joints of the neck, it heals in an abnormal position and scar tissue will hold it there in that position. Abnormal position always contributes to abnormal mechanics, and so over time the wear and tear associated with abnormal mechanics produces additional irritation if left uncorrected. So some of the tissues that are commonly involved in that irritation include the neck, muscles, and supporting structures including ligaments, and often sensitive nerve structures that lie in the brainstem, which is at the base of the skull and the upper neck. Now, when it comes to Meniere's disease and symptoms related to hearing, vertigo, balance, and those types of issues, it's important to understand some of the nerve tissues that can be affected by those types of injuries. In the brainstem resides the nuclei, or the centers, of several cranial nerves that supply the tissues that are often affected. So, for example, the vestibulocochlear nerve, which is the 8th cranial nerve, distributes branches to the inner and middle ear and also to the vestibular apparatus. And so when we start to see symptoms related to those types of functions, it's important to consider that the nerve tissues may have been affected by that structural abnormality.